Hello, everyone, and thanks for tuning in. My name is Marcel Vander Wier, and I'm the editor of OHS Canada. I'm joined today by Dan Strand, Director of Prevention Field Services at WorkSafe BC in Richmond, BC, Mike Parent, Vice President of Prevention Services at Workplace Safety North in North Bay, Ontario, and Tim Peterson, Vice President of Prevention at WorkSafe NB in St. John, New Brunswick. The goal of this session is to hear from each of you on how your organization is assisting employers in developing safe workplace policy as Canadian provinces begin to reopen their economies following COVID-19 closures. I'm pleased to have 3 provinces represented here, and I'm looking forward to getting a broader picture of current health and safety discussions across Canada. So without further ado, let's hear from each of you. Dan, potentially let's begin with you. As the BC economy begins to reopen, how are you advising employers on refreshing their workplace health and safety policies?
Thanks, Marcel. Yes, just yesterday we actually had our Premier, John Horgan, announced to the province that we'll be opening in the middle of May. Those businesses that were closed or asked to shut down we're now looking at reopening. But throughout this, we at WorkSafe BC have been conducting a significant amount of virtual inspections throughout the past 6 to 8 weeks. And so, the conversation remains the same about, we certainly recognize the importance of getting workers back to work and getting the province back to work, but we're going to do that safely. We're going to do that through by virtue of asking employers to follow guidance from our Provincial Health Office, as well as, what I would allude to be those very basic principles and following the hierarchy of controls with respect to almost any hazard or risk that you would face in a work setting. Those businesses just happen to have the benefit of the past 4 to 6 weeks or 8 weeks, and media and the whole world focused on this particular risk in the workplace to start them out on that path to creating a safe work environment. And so what we have done is created industry-specific protocols and procedures to assist those employers that are coming back in a phased approach. But we're asking that the employers and the workers work together, that those areas where, again, they know their business best, that they take the precautions being recommended through our Provincial Health Office and our Centre for Disease Control and others, to then build that into their plan for safe resumption. And have a plan in place and recognize the risks and recognize the controls. We all know about physical distancing and hygiene and just how that is then going to translate into their particular work environment. So we're providing materials and checklists, but workers and employers know their workplace best. They're in the best position to build that plan and that safe resumption plan, and we're going to help them with tools and information accordingly.
Great. Yeah, Tim, potentially we'll go to you next. What advice are you giving New Brunswick employers?
Certainly, well, similar here in New Brunswick in terms of we're kind of into a phased reopening. So we've had some essential businesses that have continued to operate, and now tomorrow we'll have an announcement from Premier Higgs with respect to the next phase of reopening. So certainly we're the prevention team here in New Brunswick is we're bracing for an influx of calls over the next few days for sure. One of the requirements here in New Brunswick to reopen your business is that you have documented an operational plan. So you've gone through a risk assessment process and you've put some mitigation policies and procedures in place, and you've documented that in a plan, and that'll be a requirement to have before you're actually allowed to open. We've also developed a guide, pretty comprehensive guide for the businesses here in New Brunswick, so we're able to provide that We've worked very closely. This will be a theme for me throughout our conversation today. We've worked very closely with public health, public safety, and the Work Safe New Brunswick team. And that alignment really has allowed us to, I think, react to an environment in which things are changing, not just hourly, but sometimes by the minute. So that's been a real success. We've put together a kind of specialized COVID-19 team here to deal with incoming requests from workplaces. And certainly, I think probably one of the most successful things that we've done so far is we've been able to engage with industry-specific stakeholder groups. So this week alone, so far, we've had about 40 sessions with stakeholder groups, and all told, by the time we're done, we'll be over 200. And those are sessions we're running together with public safety and public health. So it's been really well received. It's an opportunity to kind of explain the role of each of the organizations and how we want to work with businesses. We all want this to succeed for the sake of all the employers in the province and the economy here in New Brunswick in general. So, been very well received. Gives people an opportunity to ask questions, and there have been a lot of questions. There's a lot of uncertainty around many things. So, probably of all the things we've done, those engagement sessions I think have been key.
Great. Mike, what about you in Northern Ontario? Can you talk about that?
For sure. We support some of the sectors that were deemed essential by the provincial government. So right away, even though we were forced to our homes, we quickly had to adapt and be there for these firms. In mining in Ontario, it's regulated that they do risk assessments. So that sector has been pretty good at understanding or identifying and assessing the risk and mitigating that risk with controls. We work closely with them to understand what kind of controls we should have in place so they can continue to operate. And we brought some of that information to the other sectors we serve. As far as preparing for the future, as you probably know, Ontario's been hit fairly hard, second hardest hit province in Canada. So the Ford government's taking a staged approach as well, very cautious, and we're preparing to support them. So as businesses start to open, we've put together an assessment tool. It's a fillable PDF that is pretty basic, but it provides guidance for employers to review and kind of look at those 5 key areas to ensure they have adequate control. So we're looking at things like employee physical and mental health assurance, hygiene measures, government notices, regulations, sanitation, and proximity physical distancing. And we believe by trying to keep this from being complicated, we'll be effective in helping employers reestablish new procedures, new protocols they're going to require as they start to accept the public again. And we've remained open for business as far as being able to respond to the needs of the firms that look to us for help. Our team members have been sitting at home, but everybody's been actively engaged daily, and we stay connected to the industry. Although the COVID-19 pandemic has caused us to shut down some of the key events we had, we did a virtual conference third week of April, and we had the highest level of people register and attend than we ever have. And I think that people connect with the opportunity to do something different, listen to something different. We had some classic keynotes that we showed their sessions from the past, and then we had them to sit back and kind of do a roundtable discussion with a few of us, and it was quite successful. So we've done a lot, and we plan to do a lot more to help Northern Ontario firms and a lot of other firms in Ontario as well.
Excellent. Thank you to each of you for your comments. Tim, I'll go to you with the next question, and I'm just wondering what type of effect the COVID-19 pandemic will have on workplace interactions going forward. Can you comment on that?
Yeah, that's a great question. It's really difficult to predict the magnitude, other than to say that certainly the impact will be significant. The notion of physical distancing, screening, hygiene, sanitation, face coverings, it's just going to become part of our norm, I think, probably long after this pandemic goes away. But a couple of things that I find very positive coming out of this is certainly as an organization, it's forced us at Work Safe New Brunswick to find different ways to work, different ways to connect with our teams, and in many ways, it's brought the team closer together. We're in much more frequent contact, albeit not face to face, but it's really challenged us to work differently. Dan mentioned some of the ways that they're working with workplaces remotely, and we've been doing that. So we found ways to make this work. I think probably the biggest silver lining in all of this is that going forward, it really has heightened awareness of the importance of health and safety in the workplace. And it's an opportunity for us to leverage that heightened awareness as we move forward.
Mike, any further comments on how you feel workplace interactions will change?
I agree with Tim. I think significantly, until a vaccine is made broadly available, because of the consequences of such a viral infection, that the control measures we see are going to be around for some time. Long term, I think I also agree with Tim. I think we're going to think and behave differently. I think that this is really going to emphasize the health and safety, and that now that we see the consequences of something like a virus, a microorganism that wreaks havoc with our world, we don't want to repeat. I don't believe in the future of being forced into isolation, being forced not to be able to access the people we care and love. So I believe that long after this is cleared away, we will be different as people in how we interact socially and at work.
Dan, any other comments you'd like to add on that? Or?
Well, I'd say similarly. I think what I look at is this particular pandemic crisis in terms of what the opportunity is to a degree, and the importance placed on this on taking those precautions, understanding even the elements and the concepts of risk and the hierarchy of controls and all those kinds of things. For me personally, I know that is the right way to manage health and safety. And so I see these organizations and employers starting to use that language. And frankly, I feel it can be actually a springboard to something into the future as we look at, workplaces. There's still horrific injuries and fatalities and such. And so we almost to an extent want to use this to say that, safety can be done. Again, with an input from workers, all important. You can develop those cultures and really show that leadership, which then will translate to, frankly, even safer workplace. I think we could, if I want to look, and it's not going to be that much longer into the future, where else, in my estimation, these companies are going to embrace safety and culture and the concern for workers and the public, obviously, as they come into their establishments. And I feel we can use this to then build stronger cultures and a focus on health and safety. And as we say, the health and safety gets kind of a bad rap in a lot of cases, and there's not as much focus on disease and eliminating disease in workplaces. And so this is one of those efforts where time spent on looking at elements of hazard and associated risk and driving that down, eliminating that could bode well, frankly, for workplaces and the public in general.
Great. For the next question, I'll begin with you, Mike. And I'm curious to the individual responses from each of your provinces. Is there anything that you want to highlight or share that's something that might have been unique in the way your province handled COVID-19 measures in the workplace?
I reflected upon receiving this question from you, and I had to think about it. I think what I respected was the bold and decisive actions taken by a premier. Whether I was a fan of the individual or not, I believe he's shown leadership, and he's been a very appropriate decision. The decision making he's had to make, and I think that his decision making will save lives and infection of many. Unfortunately, when you try and flatten the curve, you also elongate the curve. So, they're working now on the reopening framework, which is a phased approach, and it's going to be influenced by the declining number of new infections. This will ensure that our healthcare will have the capacity we need, in the case of a resurgence of infections. decisions. And I really respect that the decision making is based on scientific data, not emotional decisions.
Tim, do you want to comment on New Brunswick's response?
Yeah, certainly. I think maybe rather than use the word unique, I'm going to say there are things that we've done that I'm very proud of as a New Brunswicker. Similar to Mike's comments, I think that our government and our premier has acted swiftly in tightening borders and in the process of mandating self-isolation. Those are not easy decisions. They're so impactful, but they were made swiftly, and they've really paid off in terms of our experience here in New Brunswick. The other couple of things that I'm really proud of is the way that the agencies have come together, public health, public safety, and WorkSafe New Brunswick. We've collaborated really well. We've been invited into their emergency operations centers, and having people right there where decisions are being made rapidly has been very helpful. I think it serves our stakeholders very well. And then the final point I would make is that I'm really proud of the WorkSafe team in terms of the ability to adapt and respond in a time when our stakeholders need us the most.
Great. Dan, what about British Columbia? Anything you can highlight there?
I guess similar to my colleagues, there's been a significant amount of focus paid and I think well communicated from a risk communication standpoint around the province. Dr. Bonnie Henry has become an icon. And just, yeah, the Premier and the rest of the staff through the government. I can say as well that WorkSafe BC, in collaboration, as you indicate, with bylaw and with a number of other stakeholders coming together and sharing information and best practice. I'm proud of my team that we came together. We turned quite quickly our processes around where, again, we have high-risk strategies and initiatives that we have planned activity in all of our high-risk sectors, construction, manufacturing, healthcare, forestry, and numerous other. We turned within a few days to then continue that focus and actually not drop it all together on those high-risk circumstances, but rather we would introduce ourselves and to our employers by virtue of what we call the COVID icebreaker to ensure that they were knowledgeable and had those controls in place, and we're working towards those particular matters. And then also on construction sites, what I can say is construction didn't actually truly shut down in British Columbia, but rather we found a way, and these organizations and employers and health and safety associations found a way to embrace. There was anxiety, but there was a lot of communication. They embraced the really kind of what they needed to do to ensure that folks who were on site were protected, as well as those that visited the sites were taking necessary precautions. So it was iterative to a degree as we kind of ramped up, but more and more we saw unique ways that safety was being employed, and as I say, these controls were being embraced within those sites.
Tim, what advice might you share for OHS professionals as we continue to deal with the COVID-19 pandemic?
A couple of things I think are key. Number one is have a plan. Make sure you map things out. Really take time to think about it. Take time to think about the risks, unique risks that your workplace presents. Map out a plan and make sure you involve your employees in mapping out the plan. Their involvement and the involvement of the health and safety committees, I think, will be critical to the success of the plan. And I guess the final point I'd make is one of my team members shared this story with me about how we're all in the same storm, but we're not all in the same boat. And we need to really respect that and understand that at the individual and even at the workplace level, we're not at the same maturity level in terms of our ability to deal with some of these things. And we really have to think about that and ways we can provide that support to people who need a wide range of support.
Thank you. Mike, any advice that you might want to share?
Complementary to what Tim said, approach this with a risk manager lens, right? This is a hazard. Understand the hazard and the risk, and then, like Dan mentioned earlier, the hierarchy of controls in your decision making, and remain current on information. We've learned more about this hazard and the effectiveness of some controls, and false sense of security of things like medical gloves to go do shopping. It really isn't protecting you or others as much as you may believe. So, as an HS professional, remain aware of the newest information and provide that guidance to employers or the firms you work with, and always that assurance of effectiveness of the controls, right? So I mean, we can do all kinds of crazy stuff. If it's not effective, then it's really not reducing the risk, which is what we're trying to do.
Great. And Dan, I'll open the floor to you.
Similarly, just that aspect of risk communication and the importance of workers' voice in the development of those practices and procedures and what have you within site-specific requirements. And so there is a lot of information out there, some misinformation. Be informed, stay up to date. The conundrum around this aspect of masks, it's forever. Continues to come up, and daily, frankly, it comes up, and facial coverings and these kinds of things. No one knew what an N95 was before this, and now possibly know too much or not enough. Like it's a little bit of both. So it's, again, just risk communication, I would say, would be the biggest thing, but just show that caring and concern for people.
Great. I've really appreciated each of your comments so far. And in closing, I want to ask you one last question and give you an opportunity for any last remarks. But essentially, it's this. I'm just curious to your biggest takeaway from the safety industry's response to the pandemic. Potentially, Dan, we'll begin with you and move to Tim and then Mike.
Well, there was concern, and a lot of people were scared, whether it be, again, workers and safety professionals. They play a significant role in again, communicating that risk and helping people understand, and then helping people through making the appropriate decisions to protect themselves. And so there's been, yes, a significant amount of safety professionals who have kind of brought that risk communication mindset forward, and just that concern and empathy, and it's made a huge difference, certainly in our province. And similarly, I'll say our officers come with that same quality embedded in the work that they do, and so it's been well received. And I can say sectors in British Columbia have appreciated our approach to provide support and consultation, education. But we may have to also enforce where necessary. And so, but for the most part, a large uptake on the messaging, and the concern is there. And so it's moved health and safety a quantum leap forward here, I'll say.
Thanks. Tim?
Yeah, I just say I love that notion of being collaborative, the spirit of being collaborative. We have seen individuals, health and safety leaders in our province who on different days and in different times are competitors, but we all find a common goal here in terms of trying to improve health and safety for our workplaces and our employees. And the other big takeaway that I see from this is just I'm continually amazed, whether it's at individual level, workplace level, even at the provincial level, the adaptability of folks, the ability to kind of roll with the punches and get through this is really impressive. And then I guess the final thing I would say in closing is just a thank you to my colleagues across the country. We rely on each other a lot in terms of sharing information, sharing best practices, and I know here in New Brunswick that we are very appreciative of that. We use a lot of material from other jurisdictions. Hopefully, they find value in some of the things we're producing, and I think working together, we provide the best possible outcome for our stakeholders.
Great. Mike, I'll give you a chance to kind of close this out.
Sure thing. Another thing I'll compliment Dan and Tim is, as you know, when I was in the private sector as lead for an international mining company, on occasion we would step back and review a high-level risk assessment. I think this is an opportunity for organizations to do the same. Step back, look at your organizational risk registries. You know, the pandemic's here, it's now, and whether you're ready or not, it'll be behind us in the not so distant future. But be ready for those other plausible emergencies and crises. And on the spirit of gratitude, thank you to all the frontline workers that kind of are there to make sure we have the things and the services we need to get through this very challenging time.
Excellent. With that, I'd like to thank each of you for your comments and wish you all the best as you continue to lead Canadian organizations through COVID-19. Thank you very much.
Thanks for having us, Marcel.
Thanks for having us, Marcel. Bye-bye.